So look, let me start off by saying this is going to be a little bit different to some of the previous talks that you've had in the seminar series. And today I'm going to be talking about how we use social media data, focusing on information about location and spatial variation for population health studies. So this is going to be kind of a little bit different to what you might be used to and expecting, but hopefully everyone will get something out of this, and we'll see how we go with a sort of a take-home message as well. So let me start off by talking a little bit about the discipline of biomedical informatics and digital health. So I'm new to the position and new to the University of Sydney, and we have recently established the discipline of biomedical informatics and digital health in the School of Medical Sciences as part of the Faculty of Medicine and Health. Currently, we have 7 kind of team leads, and they're all sitting up there. And the total number of people in the discipline is technically 48, including all of our postgraduate students and research assistants and professional staff. And we're a weirdly multidisciplinary team. And speaking of multidisciplinary, what I'm going to start off with today is really a bit more about my background and where I come from and how kind of weird and strange that might be. I'm going to be talking about how social media research is being done. And I'm going to go through the kinds of social media research. And I think my aim today is to try and get people to think about what is the structure of social media research? How do they fit into our understanding of traditional epidemiology study designs? And sort of go through and assess 4 specific examples where location matters, where they use information about space and or time, and to see if we can make sense of it to get to the point where you could potentially design your own study and design one that is sort of robust and makes sense and is actually correct. So ultimately what I'm going to end up doing, hopefully, is to give you a take-home message which says that you can actually use social media data for a whole bunch of purposes, especially for spatial things. It can be useful occasionally, but it's very easy to mess it up and to do it the wrong way. And so I guess keep that in mind as we go through the next steps. So let me start off with something completely different. So I guess the kind of one of the interesting things to know about me is that I did my PhD in modeling of bushfires. So I think it's kind of relevant to the center and kind of probably a little bit interesting given that I work in biomedical informatics and digital health now. But when I started, my job was to build spatial models of how bushfire spreads. I moved on from modeling how bushfire spreads to trying to understand how to model propagation, dispersal, and biodiversity in the landscape. So that is how seeds spread, how invasive species spread, and how native fauna and non-native fauna spread around landscapes. And I actually worked in this in Western Australia, and my PhD at the University of Western Australia. And what you can see on the screen here is actually one of the contributions that I made to this idea in landscape ecology, that we could model the spread of plants and animals. And I was particularly focused on how we could represent the landscape, or how we could represent things in space. And so one of the things I showed was that the software that everybody was using to try and understand how vegetation and what they call the matrix and how that fragmentation made a difference to where animals and plants would spread. And I showed that the software that everybody was using, which used these regular grids, was problematic, and that the solutions that we have currently weren't so great. And I was really interested in things like the different methods that we would use to try and model biodiversity spread and those sorts of things. And at the time, back in those days, and we're talking more than 10 years ago now, which indicates how old I am, is that there were a few different ways that we could do this. And we could take the information about the landscape and we could build models. And here's 3 examples of the kinds of models that they used to build back in 2007, 8, 9, 10. And so this happens to be 3 examples of those models. One of those is called circuit theory. There's another one called conditional minimum transit cost. And another one which uses between-us centrality, which comes from the background that I have, which is in network science. And this is an area in Western Australia between the Peenyup and Fitzgerald national parks. And so we were interested in which pieces of land should we buy to try and improve biodiversity by providing more corridors for dispersal between these 2 national parks. Anyway, that's something just completely different. And what I discovered in that work was that there was a problem with the way that people were building, doing the research. Essentially, one of the things that they kind of missed out on was the way they represented the landscape was kind of problematic. Anyway, so I published this paper back in 2009, indicating there was a kind of a major problem with the software that was being used and the methods that people were using to try and do these models. And I happened to go back about 10 years later and look to see what was going on with the field, to see if they'd fixed it, to see how the field had advanced. And it turns out no one had read the paper, no one had cared, and they were still using the old methods, which were problematic even 10 years later. So, I mean, it was a little bit sad to see that no one had actually made a difference. And I was kind of glad that I moved on from landscape ecology, and I now work in an area in public health. So that's kind of a story and a bit of an analogy, because I'm kind of hoping that in the next sort of 10 years, I don't look back at the social media research that's being done in 10 years' time and find the same thing, that we're still producing the same problematic research, the same errors, the same issues in social media research as we have been doing in landscape ecology. So what I'm going to do now is I'm going to start with what I think is the matrix of observational social media studies and how many studies exist in these different spaces. So here's what I think in terms of the volume or the number of studies we see where social media data, and in particular it's often Twitter data or Facebook data, is being used to try and understand the world. So there are lots of studies that look at what people post on Twitter, on Facebook, on YouTube, on Reddit, and they only use social media data, and they're related to health, and they're trying to understand things about health by counting up the number of times people post something online and what they say, trying to characterize that information. There's a reasonably large number of those studies that also observe populations. And there's a reasonable number of studies that observe individuals and look at what individuals post or what individuals say over a period of time on social media. Imagine someone's Twitter timeline and trying to characterize what it is that they say. Unfortunately, there's many fewer studies that actually connect social media data to real health outcome data. So I would argue that there's a tiny proportion of studies that actually look at what people post on Twitter and on Facebook and connect that to reliable, robust information about their health. That might be a COPD diagnosis. It might be depression. It might be their attitudes towards mask use. It could be any of those things, but there's very few of the studies that actually look at social media data and connect it up to something in the real world. One of the best old study was actually from about 2013, done by Munmunda Chowdhury, and she was looking at depressive episodes of individuals and conducted a survey asked people to fill out actually 2 surveys, which would look at depressive episodes, and then looked at people's social media data over time to see if they could predict, see if her team could predict depressive episodes from social media data. And that would sit in this, I hope you can see my arrow here, but that would sit in this, this section over here. So one of the main problems we see with social media research, and if you've seen me talk on this in this area before, you might have seen me post this meme. And look, I'm hoping at least some of you have seen this meme before, otherwise it'll be a bit embarrassing that no one knows what this is. But basically, this is my issue with a lot of what social media research is at the moment, and how I think we can fix it, and how we can design much better studies for social media research as well. So today, what I'm going to do is I'm going to focus on some examples from here and some examples from here. And we're going to go through some examples. We're going to look at how they run, what they're designed. But I think what I want to do is to ask you to think about what are the inputs to the studies? How are those inputs transformed? How do they relate to an outcome? And in this case, we're always talking about health outcomes at the population level. And how they draw conclusions and generalize from that information to try and make sense of the world. So let's get started with how we normally do this with Twitter. And I'm going to be focusing only on examples from Twitter. Twitter happens to be the most popular way to do social media research. And the reason why is because Twitter is relatively open, because people who use Twitter and have public accounts generally understand that their data are visible to anyone, not just people on Twitter, not just their friends, but everyone around the world can access and look at their data at any point in time. That's kind of a known thing in Twitter. And just that overall accessibility and the ability to capture lots and lots of data all at once makes Twitter a kind of a popular way to look at social media data to try and understand things about health. So Twitter uses an API, an application programming interface, to access things, and those can be what people tweet. So those are the messages. So let's say I tweeted some ridiculous comment this morning. The text of that tweet is something that you can mine and then collect up millions and millions of them. You can collect up information about the individual users. So you could look at my profile and you could say, his name is Adam, he says that he's from Sydney, and he has some information about the kinds of things he's interested in his user profile. And the other thing you can do is you can collect connections between people. So you can look at who follows me, who I follow, and you can essentially, through a bit of work, build an entire network of who follows who replies to who, and who connects to who. You can also do things by, you can also collect things by filtering, and that's essentially the same as doing a search. And so what you can do is you can search for, we might be searching for people's ideas about COVID-19, about their mentioning masks, about bushfires. It could be anything that you might want to do. Typically the work that we've done in the past has all been around vaccination. And so we collect a lot of information about vaccination. We also have kind of one of the biggest collections of COVID-19 tweets, but we're not using them at the moment. So if anybody wants them, just let me know and you can have them. And in terms of location, which is the really important thing that we're talking about today, a very small proportion of tweets include what we call geotags. And so geotag, obviously the coordinates of where the tweet was posted from. Unfortunately, the proportion of people who use geotags for their tweets is probably well under 1%. So it's very rare to see people tweeting and using, tagging the location of the tweet. And this is interesting because if you think about it, the kinds of people who might be tagging their tweets with geographic information are probably different from other people. There might be various reasons why you would want to tag the location of your tweet. Despite that, there's still millions and millions and millions of tweets that are being produced every day that have geotags, and that's just because there are hundreds of millions of people who use Twitter. So I already mentioned that user profiles have information about the user, but they also have a specific location, a specific field in the user profile where you can take information about where someone lives or their home location. That's free text, so you can essentially write whatever you want. And so in my case, I write Sydney, Australia, and so it's possible that you can take that information and you can work out that I probably live in Sydney, Australia. You could also write, Mars if you wanted to. So that doesn't always work. And around half of the user profiles can be reliably mapped. The last way, and the way that we rarely use to try and understand where Twitter users come from, are methods in location inference. And if you think about it, the simplest method for location inference is to look at, for example, if I look at all the people I follow and all the people who follow me back, it's more likely that I'm going to be following people who live in the same place as me. And so I can use information about where I think those people are to infer where I think I am. So if half of my friends say that they live in Sydney, then there's a good chance that I probably live in Sydney as well. And so location inference methods sometimes use information about who people are connected to. They also use information about the things you mention in your posts. So let's say I talk about driving past the Opera House every second day. I could probably use that information to guess that I live in Sydney. And there are lots of machine learning methods that are being used to essentially infer location data from people. All of that is going to be very important for some of the next slides, where I'm going to be talking about 4 particular studies. So this is the first of 4, and this is a paper that was published in 2017 in a journal called Social Science and Medicine. And to give you a feeling of what I think of this paper, one of the things that they describe in the background section of the paper is that they believe that there was only one data-driven study of vaccination tweets that included 2,580 vaccination tweets. And this was a paper that was published in 2017. There's probably 50 to 100 studies that have looked at vaccination tweets in the past. But surprise, surprise, the literature review in the background of this paper wasn't particularly good. Social Science and Medicine is a well-regarded journal, not necessarily well-regarded by computer scientists or computational social scientists, but certainly well-regarded in social science and medicine. So in this paper, the authors collected tweets that mentioned 2 things, autism and vaccination. And so they collected a bit over 500,000 tweets, including retweets, between 2009 and 2015. So that's actually not a lot of tweets, and I'll show you later that it's a relatively small number. But what they did is they only looked at tweets that mentioned both autism and vaccination. And so what I'll get you to think about is, what kind of tweets would mention autism and vaccination together? Are they more likely to be promoting vaccination, or are they more likely to be against vaccination, critical of vaccination? I mean, I guess the answer is probably a bit obvious, but yeah, so that's what they did. They also talk about in this paper that less than 1% of the tweets had geotags or GPS coordinates, and that most user profiles had location information that they could then use Google Maps to kind of query and guess where they were. So essentially what they did is they took the user profile information, they stuck it in the Google Maps API, and whatever location was returned, that was the location that they assumed that the people came from. And then they tried to look at areas in the United States. I say areas rather than counties because they used kind of an unusual definition that would help them connect the information between Twitter to census data. And what they tried to do was to try and work out whether there was any variable in the census data that they had access to that could be used to predict the volume of anti-vaccine tweets. And so what they did is they took all these tweets that relate to autism and vaccination. They worked out what proportion of those tweets were anti-vaccine, as in against or critical of vaccination. And they used machine learning to do that. And so we have a number of tweets that were anti-vaccine. And what they used was a lasso model. So essentially that is when they have lots of variables, and that included all of their census data variables. And they used that to reduce the number of predictive variables that they were trying to use to predict what the volume of anti-vaccine tweets was per area, per region, okay? And as an indication, what they found was that, and this is going to be a dead giveaway for what I'm going to show you in the next slide, was that one of the variables that was sucked up into the model because it was significant was the percentage of Asian people in a geographical area. And so that just happened to get sucked up into the model because it had a strong correlation between the percentage of Asian people in a geographical area and the volume of tweets that were anti-vaccine and mentioned autism and vaccination. So what I'll do is I'll stop there and I'll show you the next slide. But I'll ask you if anyone can answer, what do you think might be the problem with that? I'm thinking of an epidemiology answer. Don't be shy. No one? Okay. Well, one of the problems with that is that they were trying to count up the volume of tweets that were anti-vaccine. And if you think about it, one of the things that's going to make a difference to whether or not there's a larger volume of tweets about anything, if you don't have a baseline or you're not looking at a proportion, is the number of people who are tweeting. So what they discovered in this paper, where they made some assumptions about what was important, and they decided that certain census data were important to be able to model the number of anti-vaccine posts. And they came up with this model, and the most important factor in that model was the raw count of the general population. And so you can see here, oh, there's a more in a chat. Hang on a sec. It's an ecological study. Yes, it is. But one of the major problems with this one here is that the most important factor, and you can see the coefficient here was 10 times larger than any other coefficient, was simply the raw count of general population. And so what they were actually modeling was how many people were tweeting about anything. They didn't actually account for the fact that if you live in LA, in New York, in San Francisco, in Austin, Texas, in Dallas, Texas, that there are more people there and they tweet more. So essentially this was a model that just counted up how many times people were tweeting, and they just happened to use some weird denominator, which was related to the number of people who posted about autism and vaccination. So you can see that this model was kind of problematic, and you can imagine how the media might take this up and look at the information about, for example, the proportion of Asian people in a particular region, and assume that, well, first of all, causality, that more Asian people means more anti-vaccine sentiment in a particular location, which is clearly not true, but also that the fact that the proportion of Asian people in a particular location or in a particular region or a particular city is also highly correlated with the raw count of the general population in the United States, at least. So this was one where there was a kind of a major problem with the model that they produced, and it was shared in the media in a way that made a bunch of assumptions about the model. And to this day, no one has really criticized this. No one has really looked at it and said that it was a problem But ultimately, the major mistake that happened here was that they were trying to count up the number of tweets in a particular location and then build a model to understand the raw count of the number of tweets, which is clearly a kind of a big mistake. Okay, so that's the first one. So here's another one. And this is one that connects posts to population health outcomes as well. And in this case, they were really interested in mental health. And you can tell they're interested in mental health because the senior author on the paper is Helen Christensen, who's from in Sydney. And this one was really about trying to look at Twitter data to try and predict or to model what they call health indices. But what they're really interested in here is some particular health indices. And one of the major ones that they looked at was inadequate sleep. And so what they were looking at was United States data. And they counted up the percentage of adults that report less than 7 hours sleep per night in each county. And they looked at lots of counties. So they looked at 3,221 US counties, and they used the cartographic boundary shapefiles provided by the US Census Bureau. So this happens to be the set of counties there. In this case, and I've already explained to you a little bit that using geotag tweets can be a problem, but this is the really interesting thing about using geotag tweets. Even though less than 1% of the population tag their tweets with a particular location, you can still get 1.9 billion original tweets from 15.6 million users from a period of around 3 years. So this is 3 years worth of tweets within a bounding box, and these happen to be original tweets posted by 15 million users. So still looks like a lot of tweets, but happens to be a very small proportion of the overall number of tweets. And these happen to be tweets that had a geotag. And so what kinds of reasons might people have to want to tag the location of their tweets? They might be tourists on holidays, they might be going out to restaurants, they might be, for other reasons, they might be tagging the location of where they are. But this is a particular subset. So this is kind of an interesting one. And what they did was they looked at the county level proportion of adults that report less than 7 hours sleep per night, and they looked at the geotag tweets, and they were trying to look at what was essentially a range of, if move this out of the way, was a range of statistical properties from the tweets that might help them model or predict, is what they're claiming, this mental health index. And it happened to be, one of them was around mental health, and this one happened to be around sleep. And so they split their data into training and testing, which is an appropriate way to do a machine learning model. And then they built up some methods to try and understand whether or not they could essentially predict the number of hours people sleep based on a whole bunch of indicators that came from the text of those tweets. The indicators themselves are not particularly interesting. They happen to be things like LIWC, which is counting up the number of emotional words or those sorts of things that come out of the text. And lo and behold, they managed to get a Spearman's roll of 0.81. The problem with this is that it doesn't really do much after they've managed to do this, and it's also not really representative because, number one, they've looked at the number of tweets. So in some cases, people might have posted 10,000 tweets. In other cases, people might have posted one, and each tweet is counted the same. So if there's 10,000 tweets from one person, then obviously that one person is overrepresented in social media data. And if there's someone who's tweeted once, then they don't really make much difference to the social media data. And all of those people would have posted locations. And so you can see that the study is ultimately not very useful. And the reason why is because they're counting up posts, and those posts are only the ones that have geotags. And so it happens to be less useful, and it doesn't really help us change policy, drive action, look at interventions. It doesn't really help us do any of those things because of the flaws that they have in the study there. So now we get into a couple of more interesting ones. So this is one that was published in 2015. And this one here connects post-population health outcomes, but it does it in kind of an interesting way. In this case, they're looking at heart disease. So they're looking at heart disease mortality, and they have a set of 1,347 US counties. So, oh, we've got a chat question. Yes. Nice example of why p-value doesn't tell the whole story. Yes, indeed. So in this case, this is a study where they were trying to predict county level heart disease mortality. And you can see in this map here that they've just got like an example of where they have CDC reported heart disease mortality and predicted heart disease mortality for one particular location. Just remember, this is one particular location, but actually looked at 1,347 US counties across the way. So in this case, don't mind me while I'm moving your images out of the way so I can see the slides as well. So in this case, they selected 1,347 US counties, and they did something which is called topic modeling. Actually, they used 4 different things. They used the words that came from all the tweets. They used phrases that came from all the tweets. They used dictionary-based methods, which include things like what I mentioned before, Luke, L-I-W-C, which looks at emotional words, swearing, positive and negative affect, all those sorts of things. But the interesting one that they used here was something called topic modeling. And so topic modeling is a classic machine learning method which tries to extract natural clusters of topics that are related to things that people talk about. And we use this often in computer science to try and understand how to cluster or group documents. And in this case, they happen to be clustering and grouping sets of tweets that came from a particular county into their various topics. So they tried to do that. In this case, the input is then these word-based features, I guess, or these factors that are related to the different kinds of words that are being used. And you can imagine if they've got 2,000 topics plus information about words, phrases, and dictionaries, they have a huge number of variables, right? And so what they're trying to do is they're trying to build a model that takes lots and lots of variables to try and understand whether or not they can predict heart disease mortality. Which is not a problem, and there's a typical thing that we do in machine learning all the time, which is to take lots and lots of variables, millions of variables, and try and predict one particular outcome. So what they did is they started by using Bonferroni correction to minimize the number of topics or features that they were going to use, and then they wanted to check. And actually, this is part of one of the good things about this study, is that they wanted to check whether or not the models that they could produce using information from Twitter were at least as good as the models that they could produce using information about the people in those counties. And so they used things like income and education, smoking, diabetes, hypertension, obesity, race and ethnicity, all those different factors that they had about the socioeconomics of people in those counties to see if they could model or predict heart disease mortality in that population. So on the right-hand side of this slide, you can see topics. And remember, I said they use topic modeling. And so these are the words that are prominent in a range of different topics. And these happen to be the topics that they found were negatively correlated with county-level heart disease mortality. So that means that the more people tweeted in these topics or tweeted about things like these topics, the less mortality they had in those counties. So that's the negatively correlated. The reason why I didn't include the positively correlated county level heart disease mortality topics is because they're all full of swear words. And I was a bit reluctant to just put a whole bunch of swear words on the slide to show you the positively correlated county level heart disease mortality topics. But if you're interested, you can always go and have a look at the paper and have a look at the interesting positively correlated topics. And so what you can see on the left-hand side is the fact that their models that use Twitter were actually better at predicting. And in this case, they have a Pearson R of around 0.4 to 0.45. In terms of trying to predict heart disease mortality, or at least they built a model that was correlated with heart disease mortality in examples where they hadn't seen them before. And so that's their definition of prediction in this case. And so you can see that when they stuck together all predictors except for Twitter, it was still a little bit less useful relative to the models that used Twitter. After this was published, and it was quite well received, I guess, in the sense that there was a lot of media attention about this particular paper, looking at whether or not you could predict heart disease mortality in a county just by looking at what people tweet. And I've listed here on the bottom left-hand side a paper that was essentially a bit of a brutal takedown. And so what they did in this paper was to show that when they changed the outcome variable from heart disease mortality to self-harm, it turns out that everything reversed. And so the topics that look negative were actually negatively correlated with self-harm, and the topics that look positive, like the ones on this page, were actually positively correlated with self-harm. And so they said, well, if it doesn't work for self-harm, but it does work for heart disease, then maybe that's not so good. It had a bunch of other reasons as well. One of the interesting things here is that they did the same thing as the previous paper, which was they took everything that they could see on Twitter, right? And so this is kind of the interesting part about this, is that they just wanted to get everything people had posted on Twitter. It didn't matter whether you were posting about your dinner, your family, whether you were talking about the latest K-pop video that you'd watched. It didn't matter. They wanted to grab all of it, and they tried to make sense of what people were posting on a whole in terms of their mood, positive and negative affect, the kinds of topics that they were talking about. And you can see here that they've got topics about, like, you know, positivity and hanging out with friends and going on holidays, or like, you know, advancing their careers and all those sorts of things that might be positively correlated with lower heart disease mortality. So that was an interesting one. And actually we took a lot of the methods and the ideas that were published in this paper in 2015 when we tried to look at connecting users to population health outcomes. So rather than connecting posts to health outcomes, we were actually interested in whether or not we could predict HPV vaccine uptake. And in fact, we did this at the state level, not at the county level, which is a little bit less interesting, probably a bit more boring, but I've got a picture of the county level information here anyway, just because it looks more interesting than the other ones. So what we did in this space, and look, we're not alone here. I'm going to abuse all 4 papers, including my own paper today. So what we did was we looked at 32.8 million Twitter users, and they were all mapped to a county or state level. We did that using location, so the kind of like inferring the location from the user biographies. So we didn't use geotag tweets at all. We ignored geotags, and we just looked at where people said they belonged. So if you said you were in New York City, then we assigned you to New York City. And so rather than looking at anything anyone had ever tweeted, in this case, what we did was we wanted to look at people's information diets. And so what we're interested in is whether or not we could look at what information people were exposed to. And so we counted up the number of exposures to any kind of information that was related to HPV vaccines. And so we collected over 250,000 tweets that mentioned HPV vaccines from the period of October 2013 to October 2015. And we used this method of topic modeling, which I described before, which is the same method that they use for the heart disease mortality study. And so we had 30 topics and 1 non-topic, which is we couldn't find a topic that matched the tweet. And we looked at what kinds of topics people were exposed to. And so each of the 32.8 million Twitter users that were mapped to a county or state level we're talking about their HPV vaccine information diet. So were they exposed to negative topics or positive topics about HPV vaccines? As an indicator, I've got on the right-hand side, it's just a scatter plot of the population of each of the states and the potential exposures that people had to HPV vaccines in each of those locations. And so you can see that some states in DC, for example, are overrepresented in terms of the number of exposures they had. And so all of these sort of make sense. There's more people who use Twitter in New York per population, more people in Massachusetts that use Twitter per population, and there's a lot more people who claim to be in DC but actually live in the areas around there. So what we were interested in is what people were actually exposed to. So rather than looking at what people were posting, we're really interested in their information diets. And we found that we could map out the topics. And so we never actually published these pictures as part of the study, but just for your benefit is to have a look at the kinds of words that were being used in each of the different topics that were related to HPV vaccines. And we looked at how often people were exposed to them. On the bottom right-hand side, you can see the negative topics in orange and the kind of more positive topics in blue. And you can see how often people were exposed to that in terms of the millions of potential exposures for each topic. And so you can see that the positive topics were actually tended to be a little bit more common than the negative topics, although there was a couple in there that were pretty common as well. In particular, on the left-hand side, I just have an example of what the relative exposure looked like for a particular topic. And this happened to be a positive topic. It actually started out as something quite negative, where Toronto Star published a kind of an anti-vaccine, or gave a platform to someone who was anti-vaccine, and then quickly reversed it, and then came out with a series of articles around, you know, safety of HPV vaccines, the importance of HPV vaccines, and they kind of fixed their narrative after they accidentally sort of talked about gave someone an anti-vaccine person kind of a platform on their newspaper. And so, because this happens to be a newspaper from Canada, you can see that the proportional, the proportion of people's information diets that were made up of this topic were more common kind of in the northern areas. So what is that? I think it's Vermont or something like that. That's up the top there, and also same on the western side of the United States. And so you can see that these are the other topics that were kind of popular in each of the different places. So on the right-hand side here, these are the kind of negative topics and the kinds of words that were common to negative topics about HPV vaccines. And these included things like safety concerns and conspiracies. And you can see the kinds of words that were pretty common between safety concerns and conspiracy topics. They also more often contain links to things like blog posts and YouTube videos, which we know is where the quality of the information there is kind of a problem. And so turns out that we can build a model, and this happens to be the same as the previous one where they called it predictive, but we really just say it's an association, where we can model the vaccination uptake. And in this case, we use information about the proportion of people between 13 and 17 who had at least one dose in 2015. And we could model that by state using information from Twitter. Turns out we did the same thing as they previously did in the other study with socioeconomic information. So we looked at things like insurance and poverty predictors, education, race and ethnicity, all those different things. And it turns out that using just the information about topic exposure, we were able to build better models. And in this case, Pearson's R of around 0.8. Or 80%, and that we can build better models than we could with all of the socioeconomic information that might make sense for HPV vaccine uptake, including things around access, which is an interesting result. Still not a great study, still some problems there. I think the fact that we're we found a correlation between people's information diets, kind of information that they're exposed to in their state as a population, and HPV vaccine uptake still doesn't really give us an opportunity to develop interventions or to try and fix the situation or change policies or anything like that, because all it really says is that if you live in a state where HPV vaccine is low, you probably also live in a state where people are listening to celebrities and reading blog posts on, clicking on things on Facebook, or sharing misinformation or those sorts of things. And so while it's interesting to see that we can find a link between the information people are exposed to and the kinds of population level health behaviors we can see, still doesn't give us that much information that we can actually use. Kind of the most interesting thing about this one is that's exactly the article, yeah. So probably the most interesting thing about this is it's probably one of the first examples where we've actually properly used Twitter data or information exposure in the same way as you would use, the same way as you would look at other kinds of exposures. And I like to give the example of trying to understand passive smoking as an exposure. If we think of passive smoking or misinformation, negative information, or information in general as the same thing, can we model exposures and can we observe exposures in the same way? And it turns out that it's probably pretty hard to measure passive smoking in a population or by location, but we can actually do a reasonable job of capturing information exposure as a variable, at least among Twitter users. It's still not perfect, and there's still certainly a couple of things that should be done better. I think that probably the future of Twitter studies will involve individual linking of information. So that would be asking people directly about their health outcomes and then connecting it to their individual level social media data, including individual level information exposure. So traditionally, the way that would have been done is that you would ask people to keep a media diary, and you'd ask them, what newspapers do you read, what online websites do you visit, what TV shows do you watch, and try and estimate their information exposure based on that. And that might be the way that you measure exposure. On the plus side, you get much greater detail about the kind of people that you're interviewing or asking to fill out media diaries. You've got a better chance at getting a representative population than you are just randomly trying to collect people from Twitter or from Facebook or from some other place. But of course, it's much more expensive and time consuming to try and do media diary studies. And so I think the take-home message, the most important message here is that social media data are sometimes useful for doing spatial modeling of health outcomes or for looking at health outcomes over space and look at how the spatial variation might matter. But it's very easy to mess it up, and it's very easy to generate completely wrong conclusions. And so I think if there's anything that you would go away with today, it would be that don't count tweets, and try and use that as your factors, and then kind of just try and map the work that we do in social media research into the same sorts of study designs and conceptualizations that you would in epidemiology. Try and treat social media research as a form of epidemiology, and I think we're probably headed down the right track. So I'll stop there, and hopefully I can have a look at everybody and see if you've got any questions.
Thank you so much, Adam. That was really interesting and quite different intake of social media and social media research, and quite interesting topic we haven't explored before in our seminar series. So thank you so much. I will open now for anyone that has any questions for Adam. You can unmute and ask the question if you like, or you can just type it for me in the chat. So
Thanks, Mona, and thanks very much for your presentation, Adam, which certainly isn't something that we think about a lot in air pollution research. I'm Michael Abramson from Monash. One of the issues you raise is what we would call clustering in the data, where you have one tweeter tweeting out the same thing thousands of times, and other people like me, I haven't actually tweeted anything for years, although I do have a rather inactive account. Is there some way in this line of research that you're able to identify the user and allow for the clustering?
Yes, absolutely, and it's relatively simple. It's to make sure that the denominator of your study is the user rather than the tweets. It's not even that hard, and that's why it sort of shocks me that we still see so many studies in the space where people are counting tweets, and rather than actually thinking about it from this kind of epidemiological point of view. You know, look, it's very easy to do. You just treat each user as the unit that you're studying, rather than trying to count up the number of tweets.
Thank you.
Actually, Adam, I have a question for you, if you don't mind. So, do you think we're going to see a booming in social media research after COVID-19 for different reasons, like masks, people perception about vaccines, or how do you think this is gonna be going in the era of pandemic?
Yeah. Look, I mean, we even are likely to see a fair few studies that look at the social media response to bushfires. I mean, that's also going to happen. It tends to be, we're going to see an expansion of studies across COVID-19, across bushfires, across masks, across all sorts of things. People are going to try and make sense of the information, and they're going to try and characterize it in different ways. The vast majority of studies won't include anything about location or spatial information. They're going to be trying to characterize what people say, and then they're going to try and make sense of that in a way that is useful in some regard. Let me go back then to something very specific, and that's around the point that Michael brought up, and the point that I brought up as well, that some people are just much louder than others. Right? And so you can imagine that if you're trying to do a study on social media and you're just looking at how many people have tweeted or who's tweeted, it doesn't matter what the denominator is, whether it's counting tweets or whether it's looking at individual people. Some people are there and they're vocal and they're talking about a particular topic, and other people are not, right? So the problem with focusing on these things to study bushfire, to study people's opinions on wearing masks, to study people's opinions on the lockdown and the policies that have happened around Australia, is that some people are talking a lot and some people are just, we call them silent observers, or you might think of them as lurkers. And so there's a problem with trying to do studies that pay attention to or count up the most visible people in the community, and giving them the opportunity to be overrepresented in the data that we look at, or ultimately just to be overrepresented in the things that we listen to, right? And so one of the major problems we have is that we don't look at evidence, we listen to scientists and politicians and celebrities, and they can be much louder or much quieter, and we still don't have a way of taking evidence synthesis and pushing it into the community in ways that are effective. And I think that is kind of one of the major problems.
Thank you, Adam. We have another question here from Smita. I will unmute her.
Thank you, Adam, for a really interesting presentation. The question I'd like to follow, I'm a community physician from Prevention, Education and Research Unit at Western Sydney Local Health District. We are working with young people, and what I'm interested in is how representative are people that tweet of the general population, and do we have, is there studies that show you know, means what percentage of young people too, you know, there are specific individuals when I see on Twitter, people like Michael Abramson, if he's not tweeting, means I would actually want to know a lot more from him compared to other people. So I just wondered if you could tell us a bit more about the characteristics of the people that are tweeting.
This is where I'm going to get myself in trouble. So Twitter is not representative, right? We know it's not. And in fact, we can measure it because there have been studies that have looked at demographics of people on Twitter and the demographics of the population in general. The interesting thing here is that I don't think there are cohort studies that are representative. If you look at the way that we recruit participants for studies, we recruit them by telephone, we recruit them online, we recruit them in different ways. And they're not nationally representative either. They don't capture the distribution across the population for the variables that we want to choose. And also they often neglect to include anybody from marginalized and vulnerable populations as well. The value of doing things on social media is that you can do two things at once. That is, you can reach a much larger proportion of the population. And because there are literally hundreds of millions of people who are on Twitter and billions of people who are on Facebook or whatever it is, that means that you are able to access a broader group of people. And if you're clever about how you do recruitment, you can then ensure that you have representation from each of the areas. You can't just randomly sample and assume that it's going to be representative, but you can correct for things. And so I think that if you're smart about the way that you do inverse probability weighting, or if you do other methods for trying to understand the people that you've recruited into your study, then you can do much more interesting things with social media recruitment. And I think that that is important to think about in terms of recruitment rather than observation, because what you really want to do is you want to access these people and invite them to participate with informed consent. And you want to ask them things like, where do you live? What's your age? What's your gender? So look, that's the very quick version of that answer is you can still use social media data to recruit participants, even if they're clearly not representative of the rest of the population. And so there's one more question here. How difficult would it be to combine data from other social media like Facebook, or sometimes people use community pages on Facebook? So there is a company that was bought by Facebook that actually provides data about community pages. And that's a particularly interesting thing to look at as well. I didn't include information about a particular study that was recently published in Nature, which looked at Facebook groups and then made some claims that anti-vaccine sentiment was going to overtake pro-vaccine sentiment on Facebook in the next 10 years. Because that, excuse my language, and I know we're being recorded at the moment, but that paper was trash and should never have been published because it's completely wrong. Yes, you can look at community pages on Facebook. It's very difficult to connect data from across Twitter and Facebook. Some of the best studies that are being done that combine data from multiple social media platforms, including things like, interestingly, Facebook, Twitter, and something called Open Table are models of influenza. And so it turns out that you can reliably predict the peak of an influenza season. Look, I don't know what's going to happen for COVID-19 and influenza from now on, but historically, they've been able to reliably predict the peak of influenza using information from Open Table, Twitter, Facebook, and a whole bunch of other things where each of them contribute to a model. The reason why Open Table contributes to the model is because it turns out that people cancel their reservations for restaurants more often when more people are sick.
I think that's pretty much it for today. Thank you so much, Adam.
Excuse me, can I ask a sorry? No.
Yeah, sure. Go ahead.
Just a quick one. Thanks for the presentation, Adam. Diego here. Just a quick one. One thing that bothers me about social media is the quality of communication. So you kind of you lose the tone, and sometimes I see that with in WhatsApp groups with friends, and so misinterpretation is pretty common. So I was just wondering, is that significant from a modeling perspective, and how would the model deal with those sort of things? If people are being sarcastic and not really meaning what they're tweeting, how can a model account for that? That's the question. Thank you.
Yeah, look, this is absolutely an important point. So let me start by saying there are machine learning methods that are being used to detect sarcasm. And so it is possible potentially to detect sarcasm, but I actually think that in the studies that we do now, we avoid that problem entirely. For example, sarcasm or short answers or things that are not informative, by compiling information about what we think about a particular person over time and also through their social connections. It's much more likely that I'm going to be able to, in fact, we've shown that we can predict whether or not someone's first tweet about HPV vaccines is going to be positive or is going to be negative or otherwise, based purely on who they're connected to. So we can actually predict in advance, before anyone's tweeted about HPV vaccines, that if they do tweet about HPV vaccines in the next week, month, year, we can predict reliably whether it'll be positive or negative, purely based on who they're connected to. It doesn't matter about the sarcasm or anything like that, because we already know that the network information is going to be more useful than actually what they tweet. Turns out people are really predictable.
Great, thank you.
Thank you, Adam. Thank you, everyone, for attending our seminar today. It was really, it was a pleasure. Thank you for all the interesting questions, and thank you for the very informative and different presentation today, Adam. And looking forward to hear more and more about your research. And good luck with your new discipline within the University of Sydney.
Thank you very much. If anybody's interested in making use of social media data in kind of the work that they're doing, or they're interested in that as a thing, just come email me anytime. I'm happy to talk for sure.
Thank you so much. That's great. Thank you so much, Adam. Thank you, everyone, and have a lovely weekend. Stay safe.
Thank you.
Bye. Bye.